right from starting of the nursing, right from the nursing stage itself, you have to be very careful that after you feed milk to your child, don't directly put them to sleep. Try and wipe the mouth with a piece of cloth, wet gauze, or maybe just a little bit of water. Feed them a little bit of water before putting them to bed. So that is the first thing that you can do. Second thing is, obviously, I mean, everybody knows this, pediatricians are nowadays suggesting that sugar should absolutely be cut for the first 1 year at least of your child's growth. So my sister, for example, did not give my nephew sugar for almost 2 years, and that really helped as well. And obviously, introduction to sugary and sticky foods should try and be delayed as much as possible. Anything that you give your child that can stick to their teeth, stick to their gums, maybe, change the pH of their mouth, should be avoided. And if you are, giving them something like that, then immediate suggestion is to make sure that either the child brushes or at least rinses the mouth with water, so that those sticky sticky food does not actually cause cavities. So a lot of, if you go into pediatrics, then you will have to, introduction to toothpaste and toothbrushes, for example, has to be really, be very, very carefully done. Children have a different method of brushing their teeth, the kind of toothpaste that they're supposed to be using, the content of fluoride in those toothpastes, the kind of toothbrushes, all of that is very different for a child. Recently, actually, a patient came to me and she was telling me that she's giving her desensitizing toothpaste to her 6-year-old child. That is such a big no-no. So, because desensitizing toothpaste are being advertised as daily usage toothpaste, obviously adults are just bringing it to their homes from, a general store. And these toothpastes have now become family toothpastes. So whether the grandparents se leke the children tak, they are all using those desensitizing toothpaste, which is the worst thing you can do. Because again, medicated toothpaste are not supposed to be used in children. So why is a 6-year-old even using a desensitizing toothpaste? The patient then responds saying that he was in pain. He was in pain, so you will have to bring him to a dentist, figure out why is the tooth hurting him. And at the age of 6, you're already, you have developed a few permanent teeth. You're starting to develop your permanent teeth. You have your milk teeth. So you have to be very clear about whether it's the milk tooth that is about to fall off that has a, cavity, or the permanent tooth that has developed a cavity. Because if it's the permanent tooth, then as soon as the permanent tooth has erupted, he has developed a cavity. That means that he is more prone to developing cavities. Then we go ahead and do something called, put him on a prevention protocol. So there's something called pit and fissure sealants. So they are very thin materials that are just applied on the grooves of the teeth, so that those grooves don't attract food particles. The sticky toffees, etc., don't get stuck in the grooves of your molars between your cusps, etc., and they don't change the pH of the mouth, causing cavities. So actually, if you really want your child to not develop cavities and put them on a prevention protocol, not only do you have to teach them the right method of brushing, ensure that you inculcate the habit of brushing twice daily since the get-go. It's difficult, yes, but that's a habit that has to last them for a lifetime. Similarly, we've spoken about this so many times, but first appointments with a dentist is so important. I and my endodontist were discussing the same thing. There was a patient who came to us, 9-year-old boy, and he needed an extraction and a cavity. The parent was so adamant that they want to get all the treatments done on a single day so that they don't have to visit again. As soon as the patient comes, a 9-year-old boy, I put him in on the dental chair. I pull a tooth out. I drill. I fill. I put him in the chair for almost an hour. He's going to hate me for the rest of his life. He's going to hate all dental procedures and all dentists. So we try and explain that to the parent. Thankfully, he understood. So we did the cavity filling first, so that he will have a more pain-free experience as his first dental experience. Then he was so happily he came back for his extraction. He got it done with very minimal pain and discomfort from his side. He was so cooperative and he left. Same thing, his own mother had to get a root canal treatment done. she was postponing her treatment, her appointment so many times, and did not have even half the amount of confidence and courage that the child had. Why? Not because it was her fault, but because when she was 9 years old, when she was, I think, 14 years old, she was taken to a dentist, and her first experience with a dentist was in a dental college. And in that college, obviously, a lot of experiments were done by children who are still learning dentistry, and she was actually, honestly, supposedly even choked by all the materials inside the mouth, overflowing of the material. And that experience has stuck with her for so many years that she was so scared to get her root canal done. Thankfully she did, and we were able to change her mindset also towards how dentistry happens today, how dentistry happens at a professional dental clinic versus a dental college. So she did understand. But basically what I'm trying to say is that the difference in the dental experiences, first few dental experiences, really defines your relationship with your dentist and your dental anxiety. So that's very, very important.